So I know it goes without saying, but hopefully this hasn't been an immediate or trauma and that you've had a chance to sort of organize your resources beforehand. What I mean is, do you have a rehab plan? If you're currently working with a coach, we want to prep your coach. We want to have that coach communicate to your potential physical therapist. And we want to bring both of those resources to your physician, or at least your physician group, so that everyone is on the same page. Remember that we take the perspective that at different points, different groups will take different leads around your care. So there's a time where we used to always put the physician at the top, but that model is a little bit antiquated, and that physician is actually only responsible for your medical care and your surgery. And the physical therapist may be only monitoring your progress around your rehab, but the actual training that you're doing and the rehab that you're doing is not done by the physical therapist. Sometimes, in some of the managed care groups, we've seen that people who have an ACL reconstruction may only have 3 visits with a physical therapist, which is clearly not nearly enough. So what we're trying to do is make sure that you have had a chance to kind of connect the dots on your team. If you're trying to get through here and afterwards, have a surgery and then kind of cobble it together, that's not going to be very good. Most of the time, physicians will actually have someone set up physical therapy for X amount of time after. Depending on the physical therapist or the physician you're working with, she may not even want you to see a physical therapist immediately afterwards. But keep in mind that your rehab is responsible and under your care. So what I would suggest is making sure that I'm not waiting around and just going to go to, Great Cuts to get my hair cut by, or see a physical therapist, or get my hair cut by someone who I've never met before. I want to have actually put that in place before. If you already have a physical therapist, it's great to sort of let them know what's going on, can get that communication so that if something comes up, you can communicate with your rehab professional. Remember always that we talked about staying in your community of trainers. So that means you're exercising with your athlete friends. You're staying in your social group. Even if you have to crutch in and do rehab, your low-level rehab exercises, your quad sets or your squeezes, and your well body training, do that in the context of your big group. So it's important that we're seeing that the coach could be the person who's helping you manage, talking about nutrition, helping you set goals, and that person may not actually be your rehab specialist. The rehab specialist may be just keeping an eye on your range of motion and some of those things, but it's actually your coach who you're spending those time with. So this is a shorthand for, let's make sure that we're having everyone on the same page, that you have everyone's number, that everyone who's sort of working to support you in this time is on the same page and has each other's numbers, so that there's a little bit more fluid flow here. And probably chances are you're already working with a coach, and chances are you have a physical therapist you like. Great. Pull them in closer and understand that instead of just waiting in this X amount of time while this thing heals up, we can be doing other things to facilitate your healing. What we have traditionally experienced, and this is a great moment to talk about this, is that the bar is set too low for most people going through this function. The bar is set for people who are very motivated. The bar is set for people who aren't creating resources. The bar is set for people who may not even have access to physical therapy or want to sort of return to high level of function. So typically what we're seeing is that the physician is saying, hey, you're set enough to go about your activities of daily living. My job is done. And the reason we're trying to redefine this approach through this protocol, for example, is that we think we can actually get more out of our surgeries and more out of our surgical outcomes. So create your rehab team, get everyone spun up so everyone's on the same page, so when you press go, it's effortless.